Hi, my name's Kevin McLaughlin, and I'm a physical therapist and researcher at the Johns Hopkins School of Medicine. The COVID-19 pandemic marked a period of major expansion in the field of telehealth. In particular, one of the areas of greatest growth was in the area of telehealth physical therapy, also referred to as telerehabilitation. Prior to the pandemic, the use of telerehabilitation was very limited due to policies restricting the types of providers that were allowed to provide telehealth and who could be reimbursed for services provided by telehealth, neither of which included physical therapists. However, a number of policy changes that occurred during the pandemic opened the door for physical therapists to begin providing telerehabilitation, which led to tens of thousands of telerehabilitation visits being conducted in the U.S. during the early part of 2020. Since the end of the pandemic and social distancing requirements, the use of telerehabilitation has declined as most patients have returned to completing their physical therapy visits in person. However, telerehabilitation may still play an important role in expanding physical therapy access for patients who are unable to attend physical therapy in person. For example, rural parts of the United States experience some of the highest rates of chronic pain in the country, for which back pain is the most common diagnosis. Rural areas have also been disproportionately affected by the opioid crisis. Importantly, back pain is one of the top reasons that opioids are prescribed in the United States, including in rural communities. Physical therapy has been shown to be an effective treatment for patients with low back pain and can help prevent opioid use among these patients. However, there are fewer physical therapists in rural parts of the United States, which means that patients in these areas may not have access to in-person physical therapy services. Expanding access to physical therapy for patients in rural communities through the use of telerehabilitation may help reduce disability and opioid use associated with low back pain. However, there has been very little research conducted to examine whether telerehabilitation is an effective treatment for patients with chronic back pain in rural communities. To address this gap in knowledge, we are conducting the ARBOR Telehealth study. Being conducted in partnership with Tidal Health, the ARBOR Telehealth study will examine the implementation and effectiveness of physical therapy delivered using video visits for patients with chronic low back pain living in rural counties on Maryland's Eastern Shore. During the 4-year course of this study, we plan to enroll over 400 patients with chronic low back pain. We anticipate that the results of this study will have important implications for the use of telerehabilitation in rural communities and help reduce the burden of chronic low back pain in rural America. For more information on the ARBOR Telehealth study, please visit our website at arbor-telehealth.com.